So picture this. It is the summer after your freshman year of college. You're at home in your rural New Jersey town, reliving some of the fun and stupid activities of your high school years, including bridge jumping. You climb up on top of the bridge and you say, I bet you I can jump straight through that inner tube as it's moving downstream. I've done it before. You didn't calibrate the size of the tube this time. So last time it was a much bigger tube. So when you jump through it this time, instead of going through the tube, you catch your foot on the tube and you invert that ankle and you kick yourself in the chin. Yeah, that really hurts. This video, we're going to talk about bad ankle sprains and how that injury took me 6 or 7 months to get over. Whereas recently, I rolled my ankle and was back to running a 9K in less than a week. Here's how I did it differently this time. But first, I'm Dr. Alex Watson and I get people ready. By that, I mean I get folks ready for fitness activities and challenges, things like that, surgeries, cancer therapies, all things that fall under the area of medical rehabilitation. In this video, I'm going to prepare you to get back to playing whatever sport you were playing when you rolled that ankle in the first place. This is all part of our series on common injuries and modern recovery techniques. And I'm going to walk you through rotator cuff tear, ankle sprains, and meniscus injuries in the knees. I also want to thank all of our new subscribers. We've had a ton of growth of the channel recently, and I'm very grateful for that. We put a lot of time into these videos as part of our team here, and we divert time away from the medical practice to do so because we really enjoy putting out educational content. So thank you for subscribing and watching. And if you haven't, that's all you got to do to support us, so I really appreciate it. Let's get into it. So first, not all ankle injuries are created equal. But today we're going to talk about the most common situation. You're running, you miss a step, you miss a ditch there and roll your ankle into it. You may or may not hear a pop, swells up, really painful. Oh man, how long is this going to last? So let me tell you about the most recent story. Unlike jumping off a bridge jackass Alex years ago, this one I was walking down the stairs of the gym and was looking at my phone like an idiot, missed a step, tumbled down the stairs, metal water bottle bouncing down the steps next to me, so everybody got a good look. That was 6 days before I was supposed to run a 9K at the beach here in Delaware, and I was a little panicked I wasn't going to get better in time. So what did I do? I dug into my bag of tricks here and threw out all the stops. Fortunately, was ready to run the race on Saturday. What didn't I do? No disrespect to anybody there, but I was offered ice repeatedly. That is the first thing I declined politely because the intentions were good. The wisdom has been appropriate at one point. This is not what we're doing anymore. I mentioned this in a couple other videos, but rice is mostly, if not entirely dead at this point, because after an injury, the last thing you want to do is rest it. You want to make sure that the body knows how to heal it properly, and it only does that with mechanical stimulus, so activities from not resting it. Number 2, you don't want to ice it. Inflammation's super important to be able to get the signal out to the body. Here's the injury, here's where it is, time to fix it, it's serious. C, compression. That one's actually not a bad idea. It's nice to have a little bit of support there. In fact, it might actually be the one part of this that I say is worth doing. Elevation. That whole purpose was to keep things from, blood from going into that injured area. Well, in this case, you want blood there because that's where all the good stuff is coming from. So you need to avoid most of that. Instead, I use heat and gentle stimulus. So the anatomy of an ankle injury. We're going to put a picture right here of the ankle, and I want to first highlight the ATFL. That is the anterior talofibular ligament, or as we call the always tears first ligament, because that is the one that goes when you do an inversion. When you tear a ligament or put it under a lot of strain, we call that an ankle sprain. Ligaments get sprained, tendons get strained. The next one, the calcaneofibular ligament. If you sprain that ankle bad enough, number 2 gets involved as well. There are other way more severe injuries like a high ankle sprain that I'm going to save for a more focused sports medicine doctor. This is more of a broad channel here, so we're going to go with the common stuff. The bigger thing here is going to be what else can be affected that predisposes you to rolling it later. And that's going to be some of the tendons that run around the ankle. So your ankle has the ability to evert, so turn outward, or invert, turn inward. The inverters, those are the ones that don't need the help here because that's the less stable angle for the ankle. You're way more likely to sprain it that way. So don't need to worry as much about the ankle inverters, but the everters, those may help you to prevent sprains because it's going to keep that ankle from turning inwards when you're stepping and stuff like that. Also just stability in general. If you roll your ankle repeatedly, you may stretch out and compromise those tendons, making you more likely to roll it next time. So what was I doing this time? I hopped on the treadmill the next day. I took that day off, but I still went to work. I hopped on the treadmill the next day, put on my most stable shoes, and walked flat, no incline, and straight. The last thing you want to do is risk a re-injury. So that's rule number 1. Don't get hurt again. Instead, I walked in a straight line to see is that ankle going to hurt and flare up while I'm walking? So now that the injury's happened, what are you doing? So you're talking to your doctor first. We'll go over my injury just to make it not medical advice here. Remember, this is for educational purposes and entertainment purposes. Go see your own doctor if you have an injury. It's important. So what I'm doing here is getting back to activity as soon as I can. Again, you got to tell the body what to do. You got to do it safely. So you want to load that ankle safely. Walking, if you can do it, keep walking. If it's painless enough or the pain's not severe enough where you can do some isometrics, I put a band on my ankle that pulls inversion and I'm just holding it steady. So if you're holding it steady, you're strengthening those everters, you're rehabbing those tendons, and you're going to have a better chance at restoring that stability of that joint there and give the rest of the ligaments a chance to heal a little better. Next thing you can do, well, before all those sort of rehab programs, you want to be sure that you're having collagen peptides and some vitamin C with it beforehand, collagen afterwards by itself. You don't want vitamin C after exercise because it's got some anti-inflammatory, antioxidant effects. You don't want to dampen the inflammation there. Pain-wise, stick with Tylenol. It's okay to use some anti-inflammatories periodically if you need it to get through something really important, but otherwise try and stick with Tylenol as it's not going to blunt that response. I mentioned this in the shoulder video, but there are some indications here where you may benefit from some of that topical nitroglycerin paste. This is one that you really want to speak with the doctor about amongst everything here. Topical nitroglycerin, I misstated in the prior video, doesn't directly impact that PDGF, that platelet-derived growth factor. What it does instead is it increases nitric oxide. In doing so, that's going to improve collagen synthesis at that site, which is why it's helpful in tendons and ligaments. You can overlap with our shoulder injury video, the rotator cuff one. I will not be so bold as to assume you've watched that one and memorized the entire thing, but you should check it out. But in this case, there's going to be a lot of overlap in terms of the other fancy stuff that you can throw at a bad ankle sprain. In these cases, we're talking about things like BPC 157 and TB 500. Now, we've got an older video on the channel that goes into the science behind those in much greater detail, but the gist of it is it increases angiogenesis from the BPC side, and what angiogenesis means is more blood vessels, so more blood vessels is better blood flow to that area of injury. Other things that are really important here is it increases the expression of those growth hormone receptors, so you're going to have the chance for that growth hormone that you're boosting to be able to bind to those receptors at the site of the injury, increase collagen synthesis there, and all those benefits from that one too. In the same vein here, anything else that can increase growth hormone is likely going to be beneficial as well. So when I injured my ankle, that time I was actually taking sermorelin. Did it help? Well, there was no control in that science experiment, so I can't tell it for certain, but I like to think it did. Fundamentals. Make sure you are sleeping well and getting enough of all the important macronutrients. So it goes back to that collagen therapy here. Take that collagen peptide mix before and after rehab exercises. When you're doing those isometrics, it's good to have the collagen sandwiched around those sessions there and do those sessions twice daily. When you do it that way, you get enough of the stimulus and the refractory period so that your body responds to that stimulus twice. Doesn't need to be intense, but it's really important to do those in a consistent fashion with a isometric stimulus. You're not risking injury, but also giving enough of the signal of here's the way to put down those fibers to heal that injured structure. Now, beyond this, it gets into very sport-specific kind of things. So you want to make sure that you're doing whatever you need to do to improve your stability in that sport. So if you're running and you rolled your ankle because your footwear was improper here, maybe it was not good ankle support for the kind of, a sport you're playing here, or the sole was too thick and it just predisposed you to injury because the mechanics or whatever. Work with your coach, work with whomever is going to be assessing these things, a physical therapist, a personal trainer, it doesn't matter. Just find a specialist in person who can assess these things, because I can't see through the camera here that's a little weird to say, because I can't see through the computer here to see what is actually the underlying factor that predisposed you to injury, unless it was you're looking at your phone and walking down the stairs of the gym, in which case don't do that. It's bad for you. I proved it. This is probably oversimplified, but that's because it isn't very complicated. So to do a quick recap, number one, don't be stupid. Ankles are pretty unstable joints, so make sure you're doing the basics to not get hurt here. Pay attention when you're walking, be mindful when you're running. If I had to say it, that's probably a bigger issue. I'm sure you know that stuff by now. Make sure your footwear is appropriate. Once the injury happens, you want to not rice it. Not medical advice. Talk to your doctor. I wouldn't rice it. You want to make sure that you are giving appropriate stimulus here. So what I did may not be what is exactly kind of by the book here, but I started with walking because it was pain-free in one single direction, then added some strength training on top of that, loaded the joint different ways, made sure I didn't have any flare-up in pain. I kept it below a 3 out of 10. That meant I can keep going on this thing. Remember, I only had like 6 days to train. Do what you can to support your recovery. It's going to be sleep. It's going to be supplements like peptides, potentially, or collagen peptides, as well as a building block here. Heat is good for bringing blood flow to the area. Exercise-wise, isometrics go along with some of the things I mentioned there of the basic loading. Isometric exercises means you're not moving. So you're avoiding movement as part of the exercise. You're holding a position against a force that's being applied to it. So that's why bands that are positioned to make your ankle invert are good ones for this one, because if you keep it from inverting, you're working your everters. And those are likely stretched out after. So you want to make sure that you're able to tighten those back up, strengthen it back up. There are a lot of interventions that we can do for this on the medical side of things, whether it be, again, injecting peptides locally, whatever, but also PRP, prolotherapy, that kind of stuff. So there are some sports medicine physicians who can much more directly treat that area of injury. But if you don't have access to somebody like that, that's where it's worth talking to a doctor about. Maybe just trying something like topical nitro. They may roll their eyes or think it's crazy, but there are some studies out there. And just want to reiterate here, there are a lot of things that can be injured in a basic ankle sprain. So this is not exhaustive by any means, not even close to it. There are other fractures and injuries that can happen in the midfoot, or different structures at the high ankle. So the syndesmosis, where the bones of your shin bone and the fibula are connected, that can tear. That's a different kind of sprain. That's a whole serious one. But in this case, I'm talking about the basics. This is what most people are going to get. Hope you found that helpful. If you want me to elaborate on something or spoke too fast because of my Jersey roots here, drop a comment below and I can go into more detail in another video. Otherwise, thank you for watching. Please subscribe. It helps us a lot. And I'll see you in the next one.